be able to launch a physical activity program for people with Parkinson's. And I did some research about what program would we want to have launched, and did some research. And clearly, Pedaling for Parkinson's is a program that's run throughout different Ys throughout the country. You kind of Google Pedaling for Parkinson's, Ys across the country pop up right away. And I looked around what was being done here in Monroe County, and there is not a Pedaling for Parkinson's program. There is a Rock Steady Boxing, there's a different program that you all run at Shotland, but there was no Pedaling for Parkinson's. So I'm like, you know what, I think that might be the program that we try to implement and get some funding for. So in April, we got our award, and we've worked up to this point we're almost ready to launch Pedaling for Parkinson's. And so, as you know, we're launching at West Side, East Side, Shotland, and our friends in Corning are launching as well. So we're very excited that they're going to have the program. So one of the things that we knew we needed to do prior to launching this program was talk a little bit about what is Parkinson's, right? Because we're going to talk about what the actual Pedaling for Parkinson's program is, and that's fairly easy, especially those of you who are cycle instructors sitting around the room. But we really want to talk about what is Parkinson's 101, how are we going to support the individuals who come and their caregivers through the program. And so Ashley, who is our guest speaker today, kind of reached out, actually randomly, and I went, oh, I found somebody to help. And we met, and I'm like, this is really what we need, is really to have like a Parkinson's 101 to help support all of you in working with participants. So I think before Ashley starts, I would like to go around the room and have everybody just introduce themselves. And I know everybody's sitting kind of in their pockets of Shotlands here, but just say what branch you're from. So we'll go ahead.
I'm Marty, and I'm with Shotland.
Tiffany at Shotland.
Sherry at Shotland.
Joanne, Shotland.
Kristen, Shotland.
Shotland.
Tom here.
Yay, Tom. Amy here.
Mike, Eastside.
I'm Elizabeth, and I'm home based at Shotland, but I teach here.
Okay.
Sydney here.
Brian here.
Chris at Shotland.
Perfect. And Mr. Avery over there at the East Side Wise, he could use a little support over there too. He's a little
We got some friends right here.
He's videotaping the training in the hopes of. So, without further ado, I'm going to have Ashley come up and start doing her presentation, and she can introduce herself. I'm going to pass out she has a presentation so you can follow along. We're going to talk, after she gets done, we are going to talk about the logistics and the protocols related to the program Pedaling for Parkinson's. But we want to do this part first, and then we'll move into that.
Yeah, sounds good.
Thank you.
Thanks for being here, everybody. Can everyone hear me okay?
Mm-hmm.
So I'm a very mobile, I move around a lot when I'm talking, so I'm going to move over here, and then I'm going to have to come back to click the screen. So hopefully that's not too distracting for you guys. So really quickly, can you, just from a show of hands, how many of you guys have worked with the Parkinson's population? You have? Okay, good. Not a ton of you. Okay, great. Well, that's good. I'm glad I'm here. It is a very complex disease. And I want to make sure that what you get out of this today is that you feel confident and knowledgeable when someone with Parkinson's comes into your class. Because it can be, quite frankly, it can be kind of intimidating. And as I'll talk about today, no two people with Parkinson's are the same. But we'll touch on some common symptoms and what you can do when they show up in class, and give you some tools and strategies for how to address them and help your classes run as smoothly as possible. So, I'm actually, as Laura mentioned, I'm a physical therapist. I'm a board-certified neurologic specialist, but I have a subspecialization in Parkinson's. So for the past 4 or so years, I've really focused my career on Parkinson's, and I now own my own practice. 100% of my clients have Parkinson's or Parkinsonism. So for the purpose of today's talk, we'll be talking about idiopathic Parkinson's disease, which I'm pretty sure is an inclusion criteria for pedaling for Parkinson's. So idiopathic Parkinson's disease is the most common type. So I don't think you'll be seeing people with other types of PD. So we'll kind of focus our talk on that for today. So that's just me in a nutshell. My practice is mobile concierge-based. I go to people's homes and see them. But it's not home care, it's actually outpatient therapy in people's homes. And then I do teach a few group exercise classes, which you'll see a couple pictures of as I'm talking today. Okay, so our objectives for today. I'll be talking like 60 to 70 minutes, kind of depending on questions. Please feel free to interject. I tend to be kind of, seem like a really formal presenter, but I promise I'm not. I love discussion. If something comes up that you want to ask a question about while I'm talking, please feel free to interject. And we'll just kind of go from there. So objectives for today, we'll talk about Parkinson's, what it is, and how the disease manifests itself in the body without getting too crazy into the pathology. I will explain current treatments that are being utilized and why exercise is the very best medicine for Parkinson's. And then we'll talk about, like I mentioned, the motor and non-motor symptoms that you will certainly see show up in your classes, and what to do when they do show up in class. And then we'll have a little summary and question and answer. All right, so Parkinson's disease and how it manifests in the body. So Parkinson's is a neurodegenerative disorder that predominantly affects dopamine-producing neurons. So neurodegenerative, meaning it is a disease that attacks the neurologic system, meaning, in this case, the brain, primarily. And attacks primarily dopamine-producing neurons, which we'll get into a little bit more about what that means in a little bit. Research has shown that exercise is the only way to slow the progression of the disease. People take medications, people might have DBS, which is deep brain surgery, but those treatments are symptomatic relief only. They don't do anything to slow the progression of the disease. In fact, in some cases, it actually makes the disease course worse. So again, there's no cure for Parkinson's, unfortunately, but it's not fatal in itself. But a lot of the consequences of the disease can be very significantly life-altering. So a lot of folks who are diagnosed with Parkinson's describe that experience as feeling like a bomb was dropped on their life because they lose so much control. A lot of people feel like their life is no longer theirs. They really worry about the future, and it can really impact a person's quality of life immediately upon diagnosis. And then as the disease progresses, all of the secondary complications that come up, which I'll talk about a little bit more, like falling. People with Parkinson's are at much higher risk for falling, and when they do fall, they're at higher risk for having an injurious fall. So a fall with, especially hip fractures, are very, very common with this population. Pneumonia is another very common secondary complication because of the stiffness and the inability for people to take deep breaths. Is another possibility for a very life-altering consequence. And Parkinson's is now the fastest growing neurologic disorder. So Parkinson's is bypassing Alzheimer's, actually, with how quickly the disease is progressing, and more people are being diagnosed. So you can see in this graph here in 1990, there were about 3 million people or so in the world with Parkinson's, and now there's about 7 million or so, and it's expected to double again by 2040. So an exponential rise.
Do they have any indication of why that is?
Yes. Yeah. So it's multifactorial. One thing about Parkinson's is it is a disease of age. So as we get older, people are more at risk for being diagnosed with Parkinson's. So 65 years old is around when the average person is diagnosed. So with our aging population, we have more people living longer. So that's one reason. Another reason, actually really interestingly, is declining smoking rates. So people who smoke have about a 40% risk of, or a 40% less risk of developing Parkinson's compared to people who don't smoke. So I know, it's so weird. So I would never advise anyone to say, hey, you should smoke so you get Parkinson's. But yes, declining smoking rates. Nicotine, for some reason, I'm not exactly sure why chemically, but it has been found to be neuroprotective when it comes to dopamine cells. So less people are smoking, and then the big thing is we are living in an increasingly chemical-laden society. So even though we know that pesticides are bad for us, even though things like military chemical exposure, so use of things like Agent Orange, those type of things continue and have been directly correlated to the development of Parkinson's. So yeah, all three of those reasons.